Hello everyone and welcome back to Tuesday Tips. I'm Dr. Vidal. Thank you so much for joining every week for our live. We go over different topics of plastic surgery and I get to answer your questions. Today we're going to be talking about the Exparel shot. So if you haven't heard about this, perfect. This is a live for you. So we're going to be talking about what is it, when do we use it, and how and why do we use it. So the Exparel shot is a medication that can be added to certain procedures, most commonly to the tummy tuck. And I'll explain why. It is very common to add to the tummy tuck, and it's for pain control after surgery. Okay, so the Exparel shot, the pharmacological name of it is bupivacaine liposome injectable solution or suspension. Bupivacaine is a local anesthetic. So one of the advantages of the Exparel shot is it's a non-opioid alternative for pain control, and it decreases the need for opioid medications afterwards. Opioid medications have been linked, as everybody knows, to addiction, but also other things that can decrease your GI motility, for example, so increases constipation, it increases your grogginess, so it increases the risk of that you are sleepy, not walking, and ending up with blood clots. So all the things that we can do to minimize the number of the quantity of opioids we take in the post-op course are good, because opioids are good as they are, because you're in pain, we don't want you suffering, but we want to minimize the amount that you need to control your pain after surgery. And the Exparel shot is one of the best alternatives that we have available to control that pain afterwards, okay? So it is a local anesthetic. What does that mean? It acts locally. It acts in the nerve endings in the muscle to block the release of sodium and other electrolytes and then blocking the transmission of the nerve or the pain signal through the nerve. So that's how it acts. Bupivacaine, it's not, and the Exparel is relatively new. It's been in the market for a couple of years, but bupivacaine is not new. We've been using bupivacaine, lidocaine, and all those cousins for years and years, so we know it is a safe alternative. Why does this make any difference than regular bupivacaine? The liposome part. So the liposome part means that the molecule, the acting molecule, it's embedded or mixed in a solution or in a system that creates a long-lasting effect by kind of encapsulating the medication and releasing it slowly over the next 72 hours. Okay, so that's why the pain is controlled for the first 3 days. Bupivacaine, not in a liposome form, numbs the area for only 8-12 hours, depending on the dosage that you're using. Liposome encoded bupivacaine lasts for 72 hours, okay? So that's why it is so helpful, because the first 3 days of surgery are the ones that the nerve endings are going to be a little bit more raw and more sensitive, so the pain levels are higher. So it numbs all that area for 72 hours, and like I mentioned, the effect is local, it's directly on the nerve and muscle ending. It is not in the central nervous systems like the opioids, so the side effects are lower. The majority of the side effects that we see with the opioids is because it's acting on the nerve, on the pain controls in our central nervous system. So it affects other nerve terminals such as GI motility, constipation, grogginess, sleepiness, and all of the other side effects that we see with opioids. Respiratory depression, which is one of the worst ones, okay? With this one, it's locally, like I mentioned, so the side effects are very low, lasts for 72 hours, and it's a non-opioid alternative. When do we use it, or why do we use it in certain procedures? It can be given in basically two forms: as a nerve block, so we put it directly in the vicinity of the nerve, blocking the entire signal to the muscle, or in the subcutaneous tissue, like when you're going to a dentist. When you're going to a dentist, they do actually both things. When they're doing those injections that are close to your bone, that's a nerve block. It's kind of blocking the nerve that comes to the mouth. When they're doing the one in the gum around the nerve, That's a more local for the terminal endings near the skin, or the gum in this case. So it's very similar what we do in a tummy tuck. In a tummy tuck, we do a nerve block, so it's called a tap block. Transversus abdominis plane block. Why? Because the nerve for the abdominal wall sensation goes in that plane. It is deep to the transversus abdominis muscle. We kind of bathe that nerve with this solution, and it kind of numbs all the muscular repair area. That way you have basically no pain or very little pain for the first 72 hours. The other area that we inject the Exparel shot is, so the Exparel shot comes in one vial. I divide that dose half for the tap block in the muscle and half for the incision, okay? So I put it subcutaneously, and that way it numbs all the incision for the first 72 hours. So this too, we do with a tummy tuck. That's why it's so good for tummy tuck procedures. In breast, we can use it as well. There is a nerve block that we can do in the pectoralis muscle. It's called a pec block. The reason why it's not that commonly used, and I don't use it very commonly with breast procedures, I've done it if the patient wants to, is because breast procedures are not as painful as the tummy tuck, okay? So the pain is usually more tolerable. The need for opioids is a lot less than with the tummy tuck. So patients usually tolerate it pretty well with maybe 1 or 2 days of opioids, and the rest is just Tylenol, and after 48 hours, NSAIDs or ibuprofen, Aleve, Advil. With tummy tucks, the pain can last a little bit longer, and the Exparel is great to minimize those first few days, okay? So with breast can also be used. Liposuction cases, I don't use it. BBL liposuction, why? Because the liposome part of the Exparel has not been proven to work in tumescent fluid. When we use lidocaine, our local anesthetic, in a liposuction case or a BBL, we use it diluted in a liter of saline. Why? Because the surface area we're infiltrating is very big. If we don't do it that way, it means that the dosage that you'll require to infiltrate all the nerve endings is going to be too high, toxic levels. So you dilute it in 1 liter of saline and then infiltrate in all those surgical areas. I don't use lidocaine because it's still a lot of lidocaine, and that increases risk of toxicity levels in the blood. But bupivacaine can be used in a tumescent setting as well, but it has the same risks of going into toxic levels because the amount is more. With liposomal bupivacaine, you say, well, you need less because it's kind of diluted. It's released in those vesicles over time, so why don't try it? Well, the tumescent effect actually bursts those vessels, and it's not working, and it actually can give you a lethal dose early on because those vessels don't sustain, so it can be giving you an uncontrollable amount of like a 72-hour supply of bupivacaine real quickly. So it's not recommended to use it in liposuction or BBL cases. So again, we use it in nerve blocks or in the skin subcutaneously, okay? Again, tummy tuck is the best because we have both alternatives. Breast, it is possible because it's a less painful surgery. Usually not a lot of patients use it. I used it today, for example, in an upper back lift, okay? The patient decided to add it, so I used it in the muscle at the level of the scar and also in the incision. So she got both. In this case was a latissimus dorsi block and in the incision. So she's gonna have very good well control. So if you're having other procedures like a brachioplasty, thigh lift, all those other procedures that are surgical procedures, not liposuction cases, it can also be added. It just depends on your goals and your pain tolerance, okay? Why are we talking about Exparel today specifically? Well, I haven't talked about it, and I think it's a very important topic, and I always recommend it for mommy makeovers, tummy tucks, because I do think that it works. The majority of my patients that get the Exparel shot really barely take any narcotics, maybe the first day. Majority of them tell me I didn't even need the Percocet. So I really think it works. The other reason is because we have a special promotion for the month of July. So if you're booking your surgery with us in the month of July, so this month you're booking, doesn't have to be for surgery July, is you're booking for surgery in the month of July. you are, and it's a tummy tuck. You're getting your Exparel for free, okay? So, because you learned all about it, you can ask for it when you call us, okay? I'll get to answer your questions now.
There are a few.
Okay, let's go.
Let's go. Will Cellulite come back after Avali?
So, the short answer is no, but certain people with a very severe cellulite may need more than one round of Avali. So let me explain this a little bit. So basically, if you're looking at the buttock on a side view, the cellulite, and this is the muscle underneath, this is skin, muscle is here. There are bands of tissue that are called the subcutaneous septi, as a fancy term, band of collagen tissue causing that dimpling on the skin, right? What Avali does is basically creates a tunnel with that cannula. It has a little light to identify that I am under that dimple and basically cuts the band, releasing that skin. So this band is not going to come back again, right? So it's not that it's going to recur or you need more than one treatment. But if you have very severe cellulite with a lot of dimples, it is not advisable to release all of those bands at the same time, because then you're creating a plane between your muscle and your skin separated, and you can have droopiness of your buttock. So it is very important to kind of keep some of those attachments. Then after this heals, then we can go and treat other areas. Okay, so that will be the reason for some people to need more than one treatment, but the reality is that it's the ones that are cut are not going to come back.
¿Dónde trabaja, doctora?
Bien fácil, en Miami, Florida. Estamos en el sur de Miami, suroeste, cerca del área de Sunset, cerquita Kendall. Así que estamos aquí a la orden, hablamos español, hablamos inglés y bien fácil, si no estás en la ciudad de Miami, puedes contactarnos a través del website, a través de nuestra página de Instagram, Facebook, pero lo más fácil es en el website. Hay un link o un enlace que se llama consulta virtual. Ahí entras tu información y entonces te damos un quote libre de costo.
Muy bien. BMI for a tummy tuck, and if you have an in-person consultation.
Yes, max BMI. This is a common question. Max BMI is 33.5, okay? I do not operate on anyone above 33.5. It is best if you go below 30, okay? Below 30, risk of complications decreases significantly. Why I do allow up to 33.5? Because there are some other conditions and mass, like muscle mass in your body, weight loss journey, that still you have like a little bit more of skin weight, muscle weight, of other conditions that you're still qualifying. But I do recommend everyone, if possible, to go below 30 to decrease the complication rate, okay? There was another question.
Yes, if you have an in-person consultation.
Yes. So I mentioned the virtual consultation online. That pathway will still be the same. You go to our website, you fill in the virtual consultation form. After I give you the quote, you can talk to your coordinator to get an in-person or an actual virtual consultation with me, and she'll let you know and help you schedule that.
Great. Could you talk about the recovery time for an arm surgery, arm lift?
Arm lift, yes. So recovery, really, majority of my patients take off of work 2 to 3 weeks, but you're still gonna have some restrictions up to 6 weeks, okay? What are those restrictions? No heavy lifting, anything heavier than 10 pounds, no exercising, and no submerging in water. So for example, if you're planning on a vacation, try to plan at least 6 weeks to 2 months after surgery. Best 3 months after. So all the swelling is recovered and you're ready for your vacation.
Okay. Do laser or micro needling help with hypertrophic scars?
Yes. Depends on the pigmentation that we're talking about. Depends on the location of the scar. but definitely a combination of microneedling with radiofrequency energy, which is Morpheus is the machine that we have here available, combined with IPL laser. IPL treats a lot of the hyperpigmentation part. So that combination, the Morpheus, which is microneedling and radiofrequency, helps with the thickening of the scar. IPL with the pigmentation helps improve the appearance of the skin a lot. We can start as soon as 6 weeks after.
Oh. Can you combine a brow line back lift and a BBL?
I actually did something similar today. It's very interesting that you asked that question. That was my case today. In very certain cases, okay? So in this patient, she is a massive weight loss patient. I had already done her trifecta a couple of months ago. So trifecta was a breast reduction, breast lift, and extended tummy tuck. Now, when she gained a lot of weight, and after losing it, she gained a lot of weight in the upper back. So the rolls in the upper back were more significant than the lower back. So she wanted to address that first, but she wanted to add some volume to the buttocks. So what I did was a lipo 180 of the back. So I liposuctioned the entire back, which I hadn't done before. It was only liposuction to the flanks with the trifecta. So entire back liposuction, upper bra line back lift, and I transfer the fat to the buttock. Why she was a great candidate for it? One of the limitations of doing this is I can only remove 1 liter of fat, which means I can only transfer 500 and 500 max, because that's what I have out, right? So it is a very minimal augmentation to the BBL part, okay? And she knew this, and that was her goal. So that's why she was a perfect candidate. But if you're looking for very, very big projection or a lot of curves, then it's better to stage it, because then I can do a 360 liposuction, remove 4 liters of fat instead of 1, and then have more fat to work around. That's it. Okay. Hope everyone learned what Exparel shot is. Exparel, medicamento para el dolor, se inyecta en el músculo y en la piel. Así que si tienes una abdominoplastia que va a hacerte pronto, considera añadir el Exparel, porque la mayoría de las pacientes no tienen dolor las primeras 72 horas y no necesitan narcóticos. Así que, y tenemos una promoción del mes de julio, que si das el depósito para reservar la cirugía con nosotros para el mes de julio, te regalamos el Exparel con el Tummy Tuck. Así que si te interesa, danos una llamadita. If you guys are interested in the promo, give us a call. It's only for the month of July, so take advantage of that. I really recommend it, so really take advantage of it. I will see you guys next week. Hope everyone has a beautiful week. See you next Tuesday.